So some foods that we want to limit and avoid on an anti-inflammatory diet would be refined carbohydrates, or those that are higher in sugar that can spike blood sugar and promote inflammation, trans fats and saturated fats, which are primarily found in processed foods, and some processed meats, and also the processed meats like sausages and bacon and deli meats that can actually lead to higher levels of inflammation. So the ultimate goal of an anti-inflammatory diet is that it's widely recommended for managing chronic diseases and promoting overall health. It's nutrient dense whole foods that support the body's natural immune function and reduce the risk of inflammation related illnesses. So taking a step back for the gut microbiota, and as I mentioned, gut microbiota refers to the bacteria within your gut. We can call it GM as well. There are basically trillions of microbes found within the bacteria in your gut. When you're born, you have a lot of diversity within the microbiome, but as we get older, we tend to lose that diversity, and that happens to everybody with age. But certain things will cause that microbiome to change a little bit faster, be it genetics, environment, diet, stress, chronic disease. For women, especially, changes in hormones, going into menopause, all of those things will affect the microbiome. Our main goal is to create as much diversity as we can within the microbiome, and then hold it as long as we can. The reason is that gut-brain connection, or the gut-brain axis. The gut and the brain are connected by what's called the vagus nerve. And we know that the more diversity there are within that bacteria, that the better that connection between the gut and the brain. Because the brain is going to manage inflammation in terms of cortisol, insulin and weight, hormones, mood, stress, all of it. If your gut microbiome is not as diverse as what it should be, a lot of people will struggle with the gut-brain connection, and ultimately it can lead to an inflammatory or systemic response. Next slide. So there's lots of different things that can shape our gut microbiome, which, as I mentioned, the medications and geographies, where you live, lifestyles, life cycle stages, how you birthing process, C-section, infant feeding method versus formula, stress, diet. All of these things will shape our gut microbiome. And this is basically going back to that gut-brain connection that I explained, that the more diverse your microbes are, the better able you are to control that gut-brain connection. And we're not all going to respond to food and consume calories the same way. Therefore, even if two people have irritable bowel syndrome or absorption issues, then they're not going to have the same microbiota makeup. It's really important to know that we're moving in a direction of more precision nutrition and away from a more cookie cutter approach. So the gut-brain connection can be enhanced by adding things. And I do like to look things as, even with the sensitivities, that rather than looking at the things that you need to cut out and restrict, look at the things that you can use to become more inclusive within your diet. Sometimes it's the things you need to add in as opposed to the things you need to restrict in order to replenish that gut-brain connection. So a lot of these foods are going to act like fertilizer for your intestines because they create a diverse microbiome. And the issue of the diversity we now have evidence in terms of what can we add in. So the fermented foods are one on that previous slide. The next thing is dietary fiber. Dietary fiber is key in terms of creating more diversity within the microbiome. And with a lot of the foods that were on that first slide, the components of anti-inflammatory diets, you can see that fiber is found in a lot of those foods, whether it's the nuts and seeds, the whole grains, the fruits and vegetables. All of those things contain dietary fiber. And we know that the recommended fiber intakes for males are 38 grams per day and females 25 grams per day. So we have found that as the fiber intake is reduced, and the average when North America is actually 10 grams per day, when the fiber is compromised, then so is your gut microbiome. There's great resources out there, and there's a lot of Dr. Google resources out there. And I like this one because it gives you the most updated research in terms of what's being done and what can be linked with a healthy gut microbiome. So it's gutmicrobiotaforhealth.com. They send you a lot of like monthly kind of here's the updated research. And because it's all evidence-based, it's a very good resource to have available to you. Probiotics and prebiotics. So other than fermented food we've talked about and fiber, and creating diversity, probiotics and prebiotics can also help the microbiome. But there's a lack of clinical evidence-based research saying that we should all be on a prebiotic. They don't work for everybody, and it's very important that we're using a strain of bacteria that you're used for matching that condition. So if somebody's looking for weight loss, it's going to be a different strain of bacteria than you would be using for somebody who struggles with constipation. So it is clinically evidence-based, but there are some benefits that they have shown. Studies need to be further. They need to do more studies in terms of different things that probiotics or prebiotics could do. And then there's functional foods. So you've seen foods on the market like kefir, juices with probiotics, BioK. Again, it's the strain that you would be using, and diet, that's okay. And supplements as well. If you look at the next slide. So the supplements that will be helpful in terms of gut healing, again, probiotics using a high quality source daily can help some. It's not good for everybody, or it's not effective for everybody. Turmeric and curcumin have been shown to reduce inflammation, especially with those with digestive problems. Vitamin D and the link with the gut microbiome is strong evidence and can help soothe inflammation. Folic acid, and then also fish oil capsules or omega-3. Important to note that you need about 2.7 grams of the 2 essential fatty acids per day, which can be found in flaxseed oil. And a lot of omega-3 supplements on the market don't even contain 2.7 grams. So ensuring that you're getting what you're wanting from supplements, because if you're getting from a probiotic juice or something with one of those orange juices is fortified with omega, a 0.5, it's not really helping you reach your goal if you're looking for benefits as a result of using omega-3. So the Mediterranean diet is what we're going to talk about first, and it's ranked as the best diet of the year for the 5th time last January. And it's basically based on traditional eating habits in regions of Greece, Italy, and Spain. So we're focusing on a diet that's rich in plant-based foods with moderate amounts of lean proteins and healthy fats. That's again coming from the omega-3 fats. And it's great for a number of different kinds of chronic diseases or disorders. One of the benefits is that it's a huge variety of foods, and it's a lot less restrictive than a lot of the anti-inflammatory diets out there. It doesn't cut out any foods or restrict calories. And so long-term compliance is much better with somebody following a Mediterranean diet, because people can match it with their preference of lifestyle and maintain it long-term.